naturally, by default, pregnancy changes everything. So part of the changes that might happen in women during pregnancy is actually what we're going to talk about today. And I'm personally so excited because I know Stephanie is a subject matter specialist in this area. Then after that, we're going to have a music interlude. Music interlude is going to help us to, be in the moment, because music also has a role in preventing the untoward effects of postpartum depression. So please sit back and make yourself comfortable. And also we're going to hear from Connie. Connie is an upcoming music artist. You don't want to miss her performance today. So that's going to be the highlight for today. So after we are done listening to presentation from Stephanie, Chinwe Chukura, who is also a co-director of this organization, will give us a welcoming address. And after that, we're going to take question and answer following the presentation from Stephanie. Then I'm going to chime in on my own part, and you will have an opportunity to ask your questions. So you can either use your video, you raise your hand, or you can chat, or you can talk, whichever one you prefer. We are going to have your back today. The essence of today's event is to know better about pregnancy and things that can happen after pregnancy, and know your role. We all have roles to play in helping the family. I believe so much in the concept of it takes a village. So when a woman is pregnant and she's a new mom, there are so many things we can do collectively to help her, especially if it's a teenage mom, if it's a teenage dad, because most of the things that happen in our society, they don't happen in isolation. They only happen when we fail to play our role as the community. We are the only community they have. So if you're attending today's event and you happen to have a daughter who is pregnant, who is a new mom, or you happen to have a son who is a new father, it will help them a lot. So share this particular presentation with them. And thankfully, it's coming towards the end of the year. So I'm so happy, and I want you to sit back and make yourself comfortable while you join, okay? Thank you so much. All right. So at this juncture, I'm gonna specifically introduce the presenter. So Uncle Chimex, please, can you put the profile of the first presenter so I can introduce her and we get started? Please keep all your questions until after the presentation. I can see someone raising his hand. And please, can you put the presenters on spotlight for now? Hello, are you there? Hello, Uncle Chimex, are you there?
Yes, I'm here. I'm here, sir. I've put the presenters on spotlight.
Okay, let me have the profile of Stephanie so I can introduce her and the music presenter.
Okay.
Awesome, guys. So thank you so much. Our guest presenter today is Stephanie Fernandez. Stephanie Fernandez is a founder of the Family Circle, a therapy and coaching practice for parents. Stephanie is a seasoned, experienced coach in this regards. She specializes in supporting parents in their transitioning of becoming parents and in other difficult situations in their life. You see, it's not everybody that can be a parent. Anybody can father a child. Anybody can be a mother of a child. But it takes a lot of training. It takes a lot of orientation to be a good parent. So that's what Stephanie will bring to board today. Becoming a parent can also trigger some unresolved traumatic experience. So traumatic experience are childhood experience, teenage experience, things you didn't deal with, then suddenly you're transitioning into a new role. So she's going to help us to provide us the postnatal. So postnatal means after childbirth, which is what we're going to talk about today. She's going to help us to provide the postnatal care, which would include the mother and also the father Remember, the father is a big part of the family, so it's not just about the mother. I'm sure you guys are conversant with the story, the sad story in Nigeria about the father that broke the hand of the baby out of rage. It can be a part of what we're going to discuss today. So when we do this, we're going to help the children in that family to develop properly and become responsible adults. So please, can we all welcome Stephanie? And at this juncture, I'm going to also introduce the music performer. So Uncle Chimex, please, can you give me the profile of the music performer, Connie? Okay, so Connie is an upcoming artist from England. And Connie herself, she struggled with mental health for a while. But guess what? Music can make a lot of things better. This upcoming amazing lady has used music as a way of helping her to get through. So she wants to inspire people, and she's proving she can be strong. And music has helped her to be herself. She's currently in full-time education studying science and criminology at college, and also working as a receptionist. You know, she just turned 18. So imagine at 18, she's really carved out a niche for herself, and she can't wait to see the next chapter in her life. And she advocates for young people. We need more people like her to use their gifts, their talent, to advocate for young people, especially young people struggling with mental health. You have to understand, we cannot isolate mental health because anybody is a candidate for mental health problems. So we should stop the stigma. We should stop the categorization. We should stop the shaming and the blaming. Anybody can develop mental health problems, including me. So I love the fact that Connie is using her music, you know, and is streaming on so many other platforms. And she started at age 16. So she and her dad are working together since the lockdown to develop beautiful music, which you're gonna hear today during the interlude. So sit back and please make yourself at home. Uncle Chimex, can you please show me the next slide? Correct. So at this point, I'm gonna give an opportunity to Chinwe Chukura, a co-founder of this amazing organization, to please give us on a few words so we can get started. Now, I'm gonna warn you, my slot is gonna be extensive. You're gonna leave this place feeling like a doctor because I'm gonna take time to make you understand what you need to know. And the problem is more in developing countries. We tend to blame people a lot. Matter of fact, there are some mothers that are currently in prayer houses. There are some mothers that have been sent back to their father's houses because they felt, oh, she's gone crazy. She hasn't gone crazy. She's just going through transition. So I and Stephanie are gonna help you guys to understand it. So Chinwe, thank you so much, and take the floor from me right now.
All right, thank you, Dr. Chudi. Welcome, everyone. Good afternoon, everyone. Welcome to our Mental Health Awareness and Stigma Reduction Seminar for the month of November. So I would talk a little bit about FACEYOUTH, what we're all about, what FACEYOUTH stands for. It's the Foundation for Advancement of Child Education and Youth Empowerment. So that's what FACEYOUTH stands for. And we're basically a grassroots inspired charitable organization. We are committed to improving the lives of disadvantaged children and youths in Scotland and basically overseas. And we have done a lot of initiatives and poverty alleviation programs over the years. We try to provide for people through different skills acquisition programs and provide for communities as well. We have done a lot of programs in Nigeria, providing full scholarships to students. And of course, this mental health awareness programs that we carry out every month. Dr. Chudi has already given you an idea of what we'll be talking about today, mental health and postpartum trauma. And I'm sure that after the presentations from himself and from Stephanie, we would be more enlightened. We'll have a better understanding of what these conditions are and how to basically live better lives and be able to manage whatever situations we find ourselves. So thank you very much and welcome to today's session.
Yeah, thank you, Chinwe. And you can see we have soft-spoken words. This is who we are. We are because you are. and we love our youths. We were once youths. So if you have your daughter, if you have your son, and especially about this time, it might surprise you that majority of pregnancies are achieved about this time because of the cold season. So do you know where your daughters are? Do you know where your sons are? You can actually invite them, because there are certain things you can't control. They're going to meet people, they're going to mingle, they're going to make friends, they're going to have girl boyfriends, but we have to make sure they are responsible and ready. So at this point, I'm gonna invite our special guest presenter in the person of Stephanie Fernandez. Stephanie, take it over from me and let's hear from you. Thank you.
Thank you so much, Dr. Trudy. Thank you, everyone, and welcome to the presentation I'm invited to give you today. I'm just going to share my screen so that you can follow along easier. There's going to be a lot of information for you, and I hope it's useful for you. Please just note down your questions that you might have, and we'll come back to them at the end of my presentation. So my name is Stephanie. I'm a registered nurse and I'm a certified RTT therapist. I'm also a hypnobirthing teacher, which means I give classes for preparing women to give birth, but also the dads. So I include the dads in this class as well. And I'm a gentle parenting coach because, as Dr. Trudy said, you need tools on how to become a good parent. It's not that it's inherent in us. We can love, we have that love, but it is so much more than love that we need when we become a parent. I'm based in Denmark in Europe, but I work with parents all over the world. And that's the beauty of the internet. It really works well to connect and to serve more people that are in need. I'm a mom of two, and my personal experience when I became a mom for the first time was exactly as Dr. Trudy said. The transition from being independent and then becoming a mom and having this baby all by myself. I was not supported by my core family because I'm living away from them, was really, really hard. So I had postpartum depression. I had intrusive thoughts. It was really, really difficult. And I didn't recognize myself anymore. And I doubted myself. Am I a good person? Am I a good mother? And fortunately, I found someone that could help me to get through this, to support my mental health. And this is what I'm here today to talk to you and to give you hope and the understanding that it is not because you are a bad person or you're not good enough. It's just a very natural, unfortunately, reaction of the mind and the body when we go through such big transitions. So what are levels of postpartum stress? I like to say it's postpartum stress and not only depression or not only psychosis or not only the baby blues. It is simply a very stressful time when you bring home a baby. You don't sleep enough. You don't know what the baby needs. You need to get to know the baby. Why is he crying? Why is he not sleeping as maybe he should? We have all these ideas of how baby should be. But there are a few levels of stress that I would just want to introduce you to quickly. So there is this baby blues that you probably heard of within the first 2 weeks following delivery. And that is very normal because, as Dr. Trudy said, your body goes through a huge hormonal change. The drop in hormones right after birth are the biggest ones that you experience as a woman. They're a bit similar to when you have your menstruation, but never at this level. So that baby blues is very normal. It just takes the body to adjust into this new way of living as a mother. And that is actually it happens quite often. So at least half of the women are experiencing this. If you experience this, give yourself some grace and some understanding and know this also shall pass. Then there is postpartum psychosis, and it's important that I mention this here because if you experience this, then you really need support because that can be very threatening for you and your baby. And 4 out of 1,000 moms experience this. And it is when you start seeing or hearing things that are not really there, when you're feeling confused most of the time. And that's not the normal confusion of, I'm not sure what my baby needs. It's like you are disoriented, you don't know where you are. Am I a mom? Did this happen to me? I didn't bring this baby home, for example. You have very rapid mood swings within several minutes. So let's say you go from crying to being completely hysterical, then you laugh a lot, and then all of a sudden you're completely sad and everything happens super fast. Then you have paranoia. That's a sign of psychosis, thinking that others are, wanting to harm you, or he's looking so much at me. Why is he looking at me? And you're really like focused on, what is my partner doing? And he just wants to harm me. He thinks I'm not a good mom. And also behaving recklessly in a way that is harmful for you or for your baby, like physical harm or verbal harm, like being, really loud, shouting, but also becoming violent, like what Dr. Trudy said, is things happen that parents are so overwhelmed that they hurt the baby. So that's why I think it's very important that I point this out here. Then there's postpartum depression, and that can really occur anytime during the first 12 months after a baby is born. So we might think that, oh, my baby is 6 months old and everything should be fine. Just be aware that this can happen within, the first year of a child's life. And if it's happening 2 weeks after birth or 8 months after birth, you still have the right. You always have the right to seek for help if you feel that you are depressed. And we will go into the signs of depression in a bit. And then there's birth trauma that occurs around in 1/3 of women who give birth. I'm not sure about the exact numbers in your country. So I'm here in Europe, and that's what I've used as a reference. But I think that the numbers are much higher in general because women don't really come forward with this, and there is not a very open conversation because birth trauma involves the healthcare professional. That happens when you as a birthing woman you don't feel safe. Things happen that you are not sure how to navigate them. It is not really, what happens during birth. Of course, like using a forceps or having an unplanned C-section, these can be very traumatic experiences and events, but they don't necessarily mean that you are traumatized by those experiences, and we will talk about that. But that is very difficult for healthcare professionals. And when I used to work in the hospital as a nurse, there are things that as a healthcare professional, you need to be aware of how you treat the patient and to empower the patient and include the patient. When you take away the autonomy and the independence of a patient and the ability to make joint decisions, this can be very, very traumatizing. And unfortunately, many healthcare systems around the world are not designed in a way that they are very patient-centric or woman-centric in this case. So that's why the numbers, I think, are much higher, because there is just so much risk for the hospitals and for the healthcare providers to be exposed because they did something that was not right, that they shouldn't have done. I am not here blaming anyone, because we are all humans and we are trying to do the best we can in a particular situation. But there need to be systems in place that help midwives, gynecologists, nurses, doctors to support the best care to the patient. And often that's not the case, unfortunately. So why worry about postpartum depression? And the reason is because, as we already mentioned, women are at an increased risk of mood disorders during periods of hormonal fluctuation. And that can be premenstrual, like PMDD. There are women who are suicidal during their premenstrual phase or period because they are out of themselves. They are not themselves. They don't know how to react to their children, how to respond to their partners. They cannot get out of bed. They are so depressed and they are so sad and angry that this has huge implications on them and their families. Then postpartum, as we said, is the biggest hormonal shift in a female body that one can experience. And then there are perimenopausal symptoms that can also lead to depressive symptoms. And even stress can, bounce back symptoms that woman might think, oh, I have already overcome this menopause, I'm post-menopause, but because of stress or trauma, it can actually bounce her back to pre-menopause symptoms. And in the work I do with mothers, I have found that the hormonal fluctuations are opening up kind of a Pandora box for unresolved past experiences that might have been traumatic for them. Subconsciously, you're not aware, because most of the things that we have experienced, we are not consciously carrying them with us, sometimes because it's too painful to remember or because we were too young to remember, but we still carry these memories with us and inside our bodies. The incidence of depression among women peaks between 18 and 44 years of age. So that is typically in the childbearing age. And postpartum depression is very, very common. So I want really to mark this here, that if you experience symptoms of postpartum depression or if you struggle, you are not alone. And it's not because there's something wrong with you. There's so many women who experience this shift as really, really difficult and struggle with it. So what are the potential impacts if you suffer or a friend suffers or if your partner suffers from postpartum depression? There are clear reported impacts on the baby. That means if a mother is not able to be present and nurture the baby and be able to support the baby in their development, there are delayed cognitive and psychological delays their development. They just don't have that caregiver that they would need, and the baby just needs a very present and healthy caregiver. So if you do struggle, please do reach out for help, because otherwise your child will be impacted negatively. A child is more fussier and vocalizes less, because if the mom is not able to be so responsive because she suffers from depression, it's hard to get out of bed and in the middle of the night or for the 10th time and to try to console a baby if you cannot be fully there, if you struggle so much with your own pain and with your own sadness. And the baby feels that. There are delayed motor skills, which really also reflect in the development, in the delayed development. And of course, you need more healthcare resources, you need more support. The longer this lasts, the bigger the impact is, the more you need to seek out for support. And that is when it costs the system a lot of money. So prevention and early support actually saves us a lot of pain and a lot of money. And it also has a huge impact on the marriage. I mean, just imagine if your partner is sad all the time and is not able to function in a healthy way. That has huge risks of dissolving the marriage. But not only that, it can also trigger the partner into violent activity, into yelling a lot, into demanding the mom to, just get yourself together. And she cannot. And that creates a lot of conflict, which is not a very healthy environment for a baby to grow up in. So what are the symptoms of postpartum depression? If you feel hopeless and helpless, a lot of the times, that is one symptom. There's persistent sadness, and that goes beyond like, oh, I'm so sad that I don't have the life I used to have. Like the grieving of the life we had before we had kids is very normal. But if that paralyzes you and you cannot think of anything else than the sadness, that is one sign. It's when you're very irritated and you cannot manage your thoughts and move on from whatever has irritated you. It's when you feel, I'm not good enough, I'm such a bad mom, I'm not doing a good job, all these low self-esteem issues. Then there is a lot of anger, resentment towards the baby, or even thoughts of harming the baby. And that is not because you don't love your baby. It's because you suffer from postpartum depression. And if the more you think that I'm not a good mom, I cannot care for my baby, I'm not made for this, and you think it's better if the baby is not here, better if I'm not here anymore, then please really do reach out, because it's not the truth. Don't believe what you're thinking. Don't believe the thoughts you have. This is not the truth. You are a good mom. Just need a little help. If you lose the pleasure of activities or hobbies or stuff that you usually like listening to music, like dancing, like eating well, like cooking, like going for walks, like meeting your own mom for tea, like calling your best friend. If you feel like these things don't give you anything anymore, even though they were so important, that can be one sign. Then the mood changes, the very sudden mood changes as well. And the inability to adjust to the role of motherhood. I mean, this just takes time. My son is now 5 years old, and I still feel at times that I'm still adjusting, because they grow so fast, their needs change all the time. And especially when you are a young mom and you don't really have the support system that you might need, that can be really hard to adjust. And it can just extend the time that you need to adjust. Whatever time you need, that is the right time for you. There's no timeline. It doesn't mean 10 months, 3 years, 2 weeks. It's different for everybody. So whatever you need time-wise is the right time. And if you feel that you cannot sleep, even though the baby is sleeping, that you cannot eat enough nutrients, and that maybe you don't have enough milk supply, that shows pretty quickly if you're not eating well and nourish your body, that these can also be signs of postpartum depression. So just to summarize and to point out a few, the symptoms can really range from dysphoria to suicidal ideation or psychotic depression. So the range is really, really big. And it doesn't mean that you need to have all of them all the time, but as soon as you feel, in the past 7 days, I have been feeling more sad than I have been happy. These are also signs, even if it's only sadness and not a psychosis, that you qualify for help. Everybody qualifies for help. Everybody can be a good mom with the support that they need. Half of the women are symptomatic for at least 6 months, and a third of women are continuing to be symptomatic for at least 12 months, especially if things are not changing, like especially if you are not having the support and the medical treatment, the psychological treatment that you might need. So what are the risk factors for postpartum depression? And I listed here a few, and they are, I would say, many of them are traumatic experiences. Like if you have a family history of mood disorder, if you grew up with a mom who is depressive as a child, this is very, very traumatic if your mom cannot get up and make you breakfast in the morning. But there is also this, genetic predisposition. If this is in the family, then you need to be aware of it. Doesn't mean that this is a death sentence. You can live well with a family history of mental illness. It's totally treatable. It's totally normal to live with that. You just need to have a bit more of attention to this and awareness that this is your family history. This is what you were born with. It's not what defines you, but you just need to be aware. And every mental health counselor, every GP, every OB/GYN will ask you about this if there are signs that you may have a mental illness, or if you struggle with postpartum depression. If the patient's history of mood disorder is already established, like let's say you had already in your teenage years a depression, and now you are 25 and you become a mom, it can happen that this just triggers again an episode of depression. So just be aware that if you have already been living through such a period, that you need to take extra good care of yourself. Anxiety or depression during pregnancy are risk factors for a traumatic birth, for example, but also for postpartum depression. And this is why I like also so much to work with pregnant women and to prepare them for childbirth in a very calm way, because it's so much about the birthing hormones and how they can help you to ease in the transition to motherhood. If you previously have been suffering from postpartum depression and now it's your second or your third child, it can be that this happens again because of the hormonal fluctuations, that you're just being bounced back to an experience you used to have. Then the baby blues, of course, it doesn't mean that because you are suffering or because you're experiencing a baby blues that you will slide into full-blown depression, but there is a risk here. And simply because when we are not feeling well, when we cannot take care of ourselves well, we don't know how to prioritize us as moms. We don't shower, we don't eat well, we don't sleep well, we have negative thoughts during these baby blues. We can enter in a spiral that just draws us down into the postpartum depression period. If you find it difficult to care for your child because maybe your child is colicky, maybe you find it difficult to breastfeed, of course, we all moms are very worried. Is my milk enough? Does the child get enough to eat? Why can I not console the child? Why is the baby crying all the time? Is there something wrong? Why is he not pooping? These things can cause a lot of anxiety. And if you are not able mentally to get out of this loop of thoughts and to empower yourself and see for what it is, that your child is growing on the chart, your child is awake and engaging with you, then there are not really needs for concerns that your child doesn't get enough milk or that your child has a terminal illness. But of course, during this very difficult time in the beginning, this can cause all these difficult thoughts, and I suffered from them. But it's important that you have someone who you can talk to about your concerns so that you don't stay with them yourself. Then stressful life events and poor social support are also risk factors for post-traumatic postpartum depression. I briefly already talked about traumatic birth for the mother, and I want to highlight this here because I think it's unfortunately still not covered enough, and it's what I'm so passionate about, because a positive birth, no matter how birth goes, it doesn't matter if you had a cesarean, if it was an emergency, if you had a natural birth at home, or if you went to the hospital, if the child had complications, or if everything went fine, if you were alone or with your birth partner. Whatever happens during birth, however birth happens, can be positive. And that is very, very important for you to understand that you have the power to make this birth positive. Traumatic childbirth is really an international public health problem because it creates so many problems afterwards. We think it's only that incident in the hospital or in the home when the birth was not positive, when actually it can trigger a whole lot of problems afterwards, like postpartum depression. There is a link established between birth trauma and post-traumatic stress disorder, and prior mental health disorders and poor quality of provider interactions are risk factors for birth trauma. So if you feel that the midwife doesn't hear you, if you feel that the doctor doesn't support you in your decisions, these are risk factors for a traumatic birth. Survivors of sexual abuse are at risk for being re-traumatized during childbirth. So what is trauma? Trauma is a psychic wound that hardens you psychologically. It interferes with your ability to grow and to develop. And it's really painful and you're acting out of pain. So if you have experienced a traumatic situation, how you respond and react afterwards is because of that. It's not because of who you are, or that you are a bad person, or that you are a violent person, or that you are a depressed person. It's because of what has happened. It's almost like it's a consequence of what has happened. But not all individuals who experience a traumatic event are traumatized. So a mom who experienced a traumatic birth can report, I felt out of control. I was depressed and anxious during my pregnancy because I was alone, because the father left me, because I was worried I don't have enough money, because I'm so young and I actually should still go to school. These can all be risk factors for traumatic birth, even still years after birth. So some even have postpartum stress disorder because of that. And if you're feeling shaky in any way after a difficult birth, please know that you're not alone. So many women experience that. But what can you do? How can we prevent a traumatic birth so that you can experience the best possible start into this transition to motherhood? Know what your priorities are for your birth. Do you know if you want an epidural at the moment you walk into the hospital, or are you completely, going natural for birth? It's very important that you know that, because then you can communicate your needs. Do you want immediate skin-to-skin snuggles and breastfeeding, or do you want your baby to be, cleaned up right away? It's important that you know what you want so you can communicate that. The most important thing, and there's no right or wrong here, is that you know where your priorities lie. Knowing what you want is the number one thing you need to do if you want to have an empowered birth experience. Then find a prenatal care provider that is your perfect match. And I would say there is no perfect match, but as close as possible to perfect. Someone that has similar birth priorities than you do, someone who understands what you want. So if you want a natural birth, find someone who is an expert at helping you to stay true to this desire. If you want an epidural or a C-section, then definitely stay away from the natural birth midwife or doctor, because they would just try to push you in a direction that is not comfortable for you. And again, there's no right or wrong. However you experience it and however you want it is exactly right for you and your baby. But when you find someone who is both qualified and shares your values, you have found someone that you can trust. And if you need to make decisions during birth, because birth can go all of a sudden in a completely different direction, even if you had planned it, this beautiful birth in water, sometimes it's not possible because the baby's heartbeat goes down and then they need to immediately support the baby to be born. And you need to stay safe, and the baby needs to stay safe. But if you have someone that shares your values, that you trust, it's easier to navigate these difficult moments. Build your circle of support, and not only for birth, but for motherhood in general, for parenthood in general. And this also goes out to dads. And I'm very sad to always hear that dads have nowhere to go, that dads don't have the support similar to moms have, like the moms groups or the meetups, the mom tea groups. Where do dads go? Dads also need that support, and so do you as a birthing person. It is vital to build that circle of support, and you better start already doing this now. It's a very common, it's most common that people will find a birth partner. So that could be your support system for birth, for example. It doesn't need to be the dad of the baby or the other parent of the baby. It can also be a midwife, a doula, your sister, a good neighbor, a good friend. Then get your body ready and also your baby ready for birth. And that not only means in a proper position, but that of course helps, because breech position births can be very traumatic most of the time, just because we're not prepared for that. But would you run a marathon without doing smaller runs before? Would you prepare a wedding and then you don't know where people are going to sit or what people are going to eat? You probably won't do that. So do also prepare for birth, just like for any big life event that minimizes the risk of being exposed to trauma. Read a lot of birth stories, and positive birth stories are really nice for the mind and for the brain to enter in that positive feeling. Every thought you have creates a feeling in the body. The more positive your thoughts are, the more positive your feeling will be. And if you are reading about positive birth stories, if you are watching birth stories, And that's not like the TV birth story where the woman is out of herself and shouting and is very, aggressive and mean. I don't know why TV producers or show producers think that this is a funny picture of displaying a woman like that, but there are actually birth stories out there that you can watch that are more natural, more real. Reframe how you think about contractions and pain. Because if you're already so afraid of the pain that you will feel during birth, you will be super scared. That fear that you have, you bring into birth has an impact on the birthing hormones. And your birthing hormones have an impact of how you feel postpartum. So reframe how you think about pain, and that actually labor pain, the surges, the contractions are the only pain in your body that don't do harm. It's not you sprain your ankle and you have to see a doctor. You're giving birth. Your body is literally pushing a baby out. And that is, a natural way of bearing the baby down. But it's not the pain that you might associate when you hear pain, like you broke your arm or you sprained your ankle. Relax and enjoy the moment. That's what I tell every parent, especially when they're very afraid of birth. This is the time you will meet your baby for the first time. The more you can be relaxed and, centered in yourself, the more positive the experience afterwards will be. And I do teach this in my hypnobirthing course because I think it's so powerful. You need to build confidence and empowerment. And that not only goes for birth. If you're empowered and confident as a mom, you can stand behind your decisions. You can trust that your instincts are the right ones, that this is what my baby needs, this is what I need. You release and prevent fear, and you understand your body and birth so that nothing happens, without preparation. The stages of labor if you do a birth preparation course. You're looking forward to meeting your baby. You know how to relax. Your partner knows how they can support you. There's so much a partner can do. They don't need to stand or sit in the corner or in the waiting room, even though it's you who is going to give birth. But the more they are included, the more they feel empowered themselves and take on the father role much more independently. So it's really important to trust your body and your mind so that you have a much easier transition into motherhood. Coming back to postpartum depression and this struggle in the postpartum period, what can be done when you struggle? And I think, so this is a call to all the healthcare professionals that are listening today, but also to a friend or to a partner. Screening is so important because only when we do a proper screening according to measurements and according to standardized questionnaires, we can actually see the things as objectively as possible. Because just by listening occasionally to someone saying, I'm so sad, I don't know how to take care of my baby, I'm crying most of the time, I'm so depressed, I'm super angry, I don't take care of myself. It's difficult to understand what is the extent of it. So a screening really helps to understand and to put a number on it so that this number kicks off a series of interventions afterwards. And during postpartum visits, there are, like here where I live, there are postpartum visits. And even if they are not organized strategically or structured in where you live, but do seek someone who can see you sometimes. So do go and see someone with, I guess, the baby will be weighted, the baby needs to be measured. But then also tell them that you are struggling. If you are a friend, you can ask these 3 questions. Have you felt overwhelmed in the last few days? How have you thought of harming you and the child? Do you have difficulties adjusting? These are very easy questions you can ask. And if there is a yes to these questions, please do reach out to your healthcare provider. I just quickly want to go into the treatment because there are just a few things that can be done. There's therapy, which is like talk therapy or the therapy that I offer. Then there's medicine that you can take that helps you to adjust. And there are support groups, like informal support groups to meet other parents, other moms, to meet in a group of that is sometimes led by a therapist, just to feel that you are taken care of. And sometimes it's a combination of things that you might need, and sometimes it's only one thing you might need. And that's okay. Whatever you might need, everything is for the good to support you and your child. So I really hope that this helped you to understand that there's nothing wrong with you and that you get the confidence to reach out to someone if you experience that you struggle. Thank you so much for listening.
Wow. Wow. Thank you, Stephanie. I actually have to, give her a little prop because we can spend the whole of today and we won't get the best of her. I personally felt this peace listening to you. I know I'm a man, but I felt like I'm actually a mother because everything you mentioned actually hit the right chord. So can we all applaud Stephanie for that beautiful presentation? Stephanie, what I want you to do for us, please share this slide with Ife and share your contact details, because this is just the beginning of the journey you're going to help this organization with. We have a lot of people that are actually going through this as we talk. We have a lot of women that are actually blaming themselves. And the environment where you live can affect how you think.
Yeah.
And pregnancy is a journey. It's not a destination. Like you rightly said, you're living the experience. And it's not all the time you feel people that feel comfortable to tell their story. You had the experience. You told your story. You are now talking about this from a first-person perspective. So thank you so much for this amazing presentation. And at this stage, please, if you have any question, if you have any contributions, we're going to make it snappy. Please quickly ask Stephanie. Stephanie, can you stop your screen so we can bring you forth so we can start asking your question? So it's time for Q&A. This is the best we can get from Stephanie. So we are going to milk her before she leaves. So ask her specific questions. You can use your video, you can use your audio, or you can use the chat window. After this, we're going to have music interlude from Cassie. We're going to have fun. Then I'm going to come back. Like I told you guys, she's done the heavy lifting. Majority of what I'm going to tell you guys, she's already done that. I felt like, I'm actually in another training altogether. So it's time for questions, please. If you need to ask any question, if you need to contribute, please raise your hand. Then we're going to bring you forth. Okay. Now, Stephanie, when you were discussing, it felt more like we were having medical correspondents. Our population, some of them are not really medically oriented. So can you tell us a little bit about premenstrual? I know you probably meant PMS, the different medical terminologies that might be confusing to them so they can understand it better. So when we talk about postpartum, what do we need by postpartum, please?
Well, it's really the time after you have given birth, and it depends on whom you talk to, but that can be 2 weeks after birth. But I like to really postpartum. I'm still postpartum, and my child is 5 years old. So yeah. It's just really the time after you have given birth.
Correct. So we can have acute postpartum and chronic postpartum. So she fell into the chronic. So anytime you go beyond 6 months, it's actually classified as chronic. So you can never stop being a mother until you go. Stephanie, I'm sure if your mom is still around, your mom is still your mom. She still treats you like a baby. So that's who we are. Motherhood is a journey. It's not a destination. I think if he wants to contribute, so if you please feel free to ask your questions. Go ahead.
Thank you. I'll have to get my video on. Thank you so much, even though where I'm at is a bit dark. Thank you so much, Stephanie, for that amazing presentation. Really, really, really deep. I know you have a lot to give, so we'll definitely bring you back. So my question is, like you rightly said, there's a lot of support for women what do we need to do, within the family unit to support the men more? So when I say men, it doesn't necessarily have to be husband. Some people have partners and some people have boyfriends or something, So how do you support your partner, when you're having that, the baby blues? Because they're also feeling their own without taking away the way you feel.
Yeah, it's a good question, and it's difficult. It's a very complex thing because in the male world now, it's such a transition of identity. Who am I as a man? Who am I as a father? Many of the men from our current generation, they don't identify anymore with how they have been brought up by their fathers, and they don't want to be absent. They want to be present, but they have not learned, they didn't have a role model. So it's difficult for them to understand, what do I want and where do I fit in? So I think how we can support them is in helping to break the stigma of support for dads and for men, reaching out for a therapist or a support group is not considered weak. It's actually a strength. And that you can learn and grow into your role as a partner and as a dad, as a husband who also cares for the child. Everything that you can do as a dad around the house, just do it. Everything that might not be related to child work or, supporting the child, like feeding or bathing or getting up at night, just bring the trash out, bring food home, because in the beginning, it's really difficult to find time to cook. If you can cook, it's amazing, but you don't have to. You don't have to do anything that feels overwhelming for you. If you can bring the laundry somewhere that takes care of it, amazing. If you can just, pick up the vacuum and go once a week through the house with a vacuum, that's amazing. Just ask the mom once in a while, how are you doing? And not only ask, how is the baby doing? That's also already a big support for the moms. But really, I think what is important here is to understand that men struggle, and they do struggle because of culture and because of generational patterns of how things have been, and they want it differently, but they don't know how. So if you can refer a dad to a program that teaches him, simple tools, what can I do as a dad? Or helps him understand what is happening with my wife. Why is she not the same anymore that she used to be? That's already a good first step.
Yeah, thank you so much. That's a very spot on feedback from Stephanie. And we have to understand that different strokes actually apply to different folks. And the role of a father, and when I mean a father, not just the person that put you in the motherhood role, a present father. We have to pay attention. We don't have to be prompted before we do the little things. It's not the big things that matter. It's the little things. It's the little, how are you? Genuinely, it's the little looking around and looking at those roles that women used to play. And you have to understand that this woman actually has a physical wound she's recovering from. So it won't be easy for her to bend to do the domestic chores, and the society expects you to be perfect. And she's also going to be up to breastfeed the baby. So there are so many transitioning you guys can go through together. And it will also be nice to also witness the birth. Lately, we give men the opportunity to be in the labor room, to be in the delivery room, so they can actually have a first-hand experience what women go through, so they can begin to appreciate them more and break away from the culture of assumptions. Women go through a lot. Even before you become a mother, you go through bleeding every month. You go through pain. Then some of them go through infertility. So there's a lot of complex things going on, and you still have to please the society. So I believe that men actually can be the game changer if we truly play the role. If you love someone, you don't just say you love someone, you show it by acting it out. So Stephanie, thank you so much for that particular feedback. And please, if you have any other question, let me see. I think I have one question from the audience, and it's from David. If you suspect someone has PPD, Mind the PPD stands for postpartum depression. How do you approach it without causing further stress? And I can see where David is coming from, because in our own culture, it's tough to actually have meaningful conversation with people. People tend to be in state of denial. People tend to be secretive. People don't open up. People feel it's a norm. So sometimes you might have good intentions, but how you go about it can backfire. So based on, you live in Denmark and majority of our members live in Nigeria, how do we mitigate this approach? What can we do differently? Please, Stephanie, take it over from me.
It's a good question. And I think it all comes back to trust, and it all comes back to connection. And if this is a friend that you see struggling, use your empathy with that friend and really tune in and take a moment, a calm moment, when you see they're struggling. And maybe you need, not to be super upfront. Maybe it's about asking, do you think some help could support you in this difficult time? What type of help do you think could you accept? So it's a lot also about how we ask the question, so that the person doesn't feel so overwhelmed. Because if you are in the midst, in the fog of postpartum and you cannot see, the question and might sound like a huge judgment, and it's like, no, I don't want to talk about this. So use your connection and the trust you have with this person. And if you don't feel that, because it's also a big thing to ask as a friend to talk about that, if you don't feel you can do it, it's very valid. You don't have to have a conversation that you don't feel equipped to have. But you could, for example, ask the support system, maybe the mom of the person who is struggling, if they have a good connection, maybe the midwife, and the next time she comes to visit, she has a more awareness because you have, pointed a few things out. It really is about the support. And I think if we have that conversation, we need to focus on, I want to support you. You are in the center. I don't want to judge you. I don't want to blame you. Whatever you're feeling is valid. And I'm just here to support you so that you have the best experience being a mom.
Thank you so much, Stephanie. That's spot on. So it's all about the approach. It's all about applying the TLC concept, tender loving care. Remember, they're going through a lot, they're processing through a lot. So what you might think might be normal might not be normal. And what you might think might be abnormal might be normal. Like, people don't just jump into PPD. It starts with maternal blues. So it's understanding is a journey and giving them the support they need. And sometimes we don't need to do much. We just need to do the little we can do, and we can all make progress. Thank you, Stephanie. So you're still gonna hang around after my presentation. We'll still take more questions. At this juncture, I'm gonna invite Uncle Chimax to please give us the music interlude from Connie. So Chimax, please, over to you. Let's listen to some music, because music is also part of the therapy. Go ahead, please.
Oh, somewhere in the we know. I walked across an empty land. I knew the pathway like the back of my hand. I felt the earth beneath my feet. Sat by the river where have you gone? I'm getting old and I need something to rely on. Now tell me when you're gonna let me in. I'm getting tired and I need somewhere to begin. If you have a minute, why don't we go talk about it somewhere only we know? This could be the end of everything, so why don't we go somewhere only we know? Somewhere only we know. Oh, somewhere only we know. This is a cover.
Wow. Uncle Chimex, please play that every Elvis Presley song. Please play that one too. Guys, let's listen to this one. Please go ahead.
Wise men say only fools rush in, but I can tell, falling in love with you. Shall I stay? Would it be a sin if I can tell, falling in love with you? Oh, like a river flows surely to the sea, darling, so it goes. Something's meant to be. Take my hand, take my whole life too, for I can tell, falling in love with you. Oh, like a river flows surely to the sea, darling, so it goes. Some things are meant to be. Take my hand, take my whole life too, for I can tell, falling in love with you. For I can tell, falling in love with you.
Wow, 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 wow. Amazing performance from Connie. So please make sure you follow this amazing lady. Can we give her a round of applause, please? This is another Adele in the making. Now, please make sure you follow this lady on all her social media handle. She's a regular in our organization, and please make sure you distribute her handle and make sure you listen to other beautiful music in her trailer load of content. So at this juncture, I'm gonna give my own presentation. Then after that, we're gonna take questions and we're gonna apply. When you leave today, remember to apply. So my name is Dr. Chudi Ufondo, and this organization is like a baby to me because we gave birth to this organization and we've seen this organization going places. So I'm gonna delve a little bit into the postpartum concept. And admin, please, will you mind giving me the permission to share my screen, if you don't mind? Okay, so I'm gonna share my screen. Just give me 1 minute. All right, guys. So what I'm gonna try to do is to kind of give us a little breakdown of what we're talking about today. So I'm sure you've heard about the father that broke the hand of the baby somewhere in Imo. Stephanie, unfortunately, it happened. Now, this might be something that we could have prevented completely if we had more communication and more conversation. If these two couples are actually communicating, maybe it could have been prevented completely. Now, postpartum depression can also affect not just the woman, it can also affect the man, and it can degenerate so fast, including thoughts of suicide, including thoughts of homicide. So suicide means trying to harm yourself. Homicide means either harming your partner or even your baby. So when you see a new mother struggling with all those thoughts, she's not going crazy. Please don't take her to a crazy home or think she's, just going crazy. Welcoming a baby can be very, very challenging. It's expected to be a happy and exciting event, but it can be different for people. So different stroke for different people. When you are giving birth and when you're becoming a parent, it can be frightening. It can be disorientating. So you have a lot of things happening at the same time. It can even be traumatic. Like when they hand you over that baby, I remember when I had my daughter, when they handed us over our baby, it was like, oh, here we go. What are we gonna do? Where do we do this? Where do we do that? And this is where social support comes in. The biggest capital in the world is your social capital. Your mom, your friends, your siblings, your colleagues, your boss, your pastor, everybody has to work together to help you to go through this phase. It's a beautiful place to be. But if you don't get this support, it can be very overwhelming. Now, between 3 to 16% of parents who recently had their baby can experience post-trauma, postpartum, post-traumatic stress disorder. Now, you have to know the difference between stress and depression. So what we normally see is people that probably have little stress or get overwhelmed and they say, oh, doc, I'm depressed. You're not the person that will give yourself the diagnosis of depression. You have to go through the ranks and files, like what Stephanie mentioned. There are tools we have to serve you. There are questions we have to ask to confirm if you have clinical depression. Then we have to classify the depression. Is it mild? Is it moderate? Is it severe? Then at the point of classifying your depression, we can begin to manage you professionally. Now, when people have PTSD, post-traumatic stress disorder, they can have panic attacks, they can have agitation, they can have nightmares, they can have flashbacks. So let me give you an example. If a lady was raped or was abused growing up, she managed to overcome that particular trauma by someone that loved her or whatever. Maybe she's trying sexual relationship for the first time, and she ended up being a mother. Guess what? She didn't deal with those sexual abuse. She didn't deal with those rape incidents. So those things that happened to her in the past can flashback. And she might feel like, oh, where am I gonna go with this little baby? So generally, following childbirth, your body and mind go through many changes. You experience a lot of anxieties during or after pregnancy. Some new mothers can develop unique type of depression, which we've been talking about, postpartum depression. Postpartum is the period after birth. Like we rightly categorized, it can be acute, just within 6 months, or it can be chronic, beyond 6 months. Like Stephanie has a 5-year-old son, and she's still telling us she's still postpartum, and she's correct. Now, most women will generally have what we call maternal blues. So maternal blues, it's just very common and it's normal. So you can feel sad or empty within few days of giving birth. It's completely okay. Now, many women will just have this about 3 to 5 days, completely okay. So if you're a new mother, especially if you're a teenage mother, if you don't have support, you can feel bad, you can feel sad. A lot of things can go through your mind. It's completely okay. At this stage, it's called maternal baby blues. Completely normal. You're not alone. Now, but when you begin to have the maternal blues that doesn't go away, and your sad feeling, your hopelessness, your emptiness, it's longer than 2 weeks. So postpartum depression actually kicks in from the point of 2 weeks. So if you feel empty, emotionless, sad, all or most of the time for longer than 2 weeks, during or after pregnancy, please reach out for help. At this stage, you need help. If you feel like you don't love or care for your baby, or you don't love and care for yourself because you have this baby, then you look yourself up in the mirror, you're seeing a monster there. Please, you might have postpartum depression, get help. A feeling of hopelessness or emptiness after childbirth, it's there. It's not regular. It's not an expected part of being a mother. So it's abnormal. Postpartum depression is a serious mental health illness. Anybody can suffer this. It's not a spiritual attack. It's not people from the village. It's not because of what the lady did. She just developed a medical condition, just like someone that has malaria. What do we need to do? We have to help this lady. Postpartum depression involves the brain, and it affects your behavior and physical health. If you have depression, then you're sad, flat, empty feelings. If they don't go away and if they interfere with your activities of daily living, if you have a new baby and you're not breastfeeding the baby, you don't care if the baby is okay. When the baby is crying, you're so irritated, please seek help. You might feel unconnected to your baby, as if you're not the baby's mother, or you might feel you don't love the baby or you don't care for the baby enough. Don't judge yourself. You're just learning. It's a rope, it's a journey, especially depending on the environment where you live. Our environment is very judgmental. Some people that are coming to see you and the baby they've already started sizing you up. They've already started judging you. So you don't feel comfortable talking to people. Even your partner might even think you've gone crazy. Even your mom, your grandmom, your mother-in-law, everybody around you might not really understand what you're going through. But I want you to be an ambassador when you leave this presentation today. I want you to be the change. I want you to be the person that will tell people around this new mother, oh, come on, guys, let's cut some slack for this lady. This can happen during or after pregnancy. Now, thankfully, from a presentation from Stephanie, there are treatments, there are therapies, there are medications that will help you and your baby to be as healthy as possible, because the impact of postpartum depression can damage the fabric of the family. It can cause physical harm, it can cause psychological harm, it can cause emotional harm, it can harm your relationship, it can cause developmental milestone delay in your baby much later. So please note, some normal changes in pregnancy can cause similar symptoms like postpartum depression. It's not in your place to decipher. This is where the medical professionals can come in. Now, Stephanie already mentioned a couple of symptoms. Many mothers are gonna feel overwhelmed. Feeling overwhelming feeling is completely normal. Now, if you have any of the following symptoms of depression more than 2 weeks, so we want you to focus on 2 weeks. Some people can actually start getting help if you have a background of depression in the past. So you might not necessarily need to wait for 2 weeks. And of course, when you're going for your ANC, would have received this information, because when you go for ANC, we review your medical history, surgical history, family and social history. So if you have a background of depression or mental health disorder in your family, by the time you're presenting for your ANC, antenatal care, would have received that information. So the information will help us to see how we can treat you differently. Now, if you're feeling restless, if you're feeling moody, if you're feeling sad, hopeless, overwhelmed, if you're crying a lot for any little thing you're crying, even happy things, you're laughing, then suddenly you're switching to crying. If you're having thoughts of hurting your baby, you are not a monster, trust me. I know this is the area that so many people will freak out. They go to social media, they start criticizing you, especially in this era. Then the more people put you out there, the more it degenerates into making it worse. So even when you're having thoughts of hurting your baby or hurting yourself or hurting your partner, seek help. You are not alone. You are not crazy. You're still a good person. Now, if you don't have any interest in your baby, the baby you've been craving for, so think about this for a moment, guys. You've been wanting to have this baby. Now, finally, the baby is here. There's suddenly a mother that wanted to have a baby is looking at having her baby. Is it normal? Of course, it's not normal. So if you don't have interest in your baby, if you're not feeling connected to your baby, if you're not talking to your baby, let me tell you this. When you talk to your baby, even when your baby is inside your belly, your baby communicates with you. Your baby knows when you're happy. Your baby knows when you're sad. The nearest and the best friend of the baby is the mother. The father is actually a stranger that will start interacting with the baby. That's why we encourage kangaroo care. That's why we encourage body touch. They want to give your baby. If you notice, once you give birth to a baby, what's the first thing the baby will do? The baby will go to your breast because the baby has already identified you. If you notice, when you talk to your baby responds. It's called social response. So your baby already knows who you are. But the father is a long journey. So you have to play more positive role in the life of your baby for the baby to recognize who you are. So it's a journey. So make sure you connect your baby. So if you're feeling that your baby is someone else's baby, if you don't have any energy or motivation, if you're eating too little or eating too much, if you're sleeping too little or you're sleeping too much, if you're having problems focusing, making decisions, if you can't remember what you ate yesterday, if you can't remember who your mom is, if you can't remember a couple of things you should be remembering, it's possible you might be going through psychosis, which is also another complex process that can happen in this situation. If you feel worthless, guilty, if you feel like you're a bad mother, if you lose interest or pleasure in activities you used to enjoy, previously you used to watch movies, lately you don't watch movies, previously you used to talk to people, you used to be a happy lady, suddenly you are no longer, you can't even recognize the person you've become. If you withdraw from your friends and family, if you're having this constant nagging headache, aches all over your body, stomach ache, which cannot go away, they can be signs of depression. If you have all this, please speak out. If you're a partner and you notice this, please speak out. Don't criticize. Unfortunately, so many women are not going to tell anyone about their symptoms. Why? Because we judge them. Because we've already written them off. People listen to criticize, not listening to understand. Now you have to understand that new mothers may feel embarrassed, ashamed, guilty about feeling depressed. So all these 21 points I've listed, they are already embarrassed. They keep asking, why me? I'm a beautiful mother. It doesn't happen in my family. Maybe it's spiritual attack. Maybe it's people in the village. So they are embarrassed. They are ashamed. They feel guilty. So that's why they don't open up. They may also worry as, they are bad mothers. Any woman can be depressed during pregnancy or having a baby. There is no exception. You can have all the money in the world. You can be poor. You can be whatever, and it will still happen to you. It doesn't mean you're a bad mother. You and your baby do not have to suffer. Please, there is help. You can call your doctor immediately and we can begin to figure out how we can help you. Now, what are the likely things that might lead to this postpartum depression? Remember, when you become pregnant, pregnancy changes everything about you. So the hormonal changes in pregnancy can trigger symptoms of postpartum depression. When you are pregnant, levels of the two important hormones that control your pregnancy, estrogen and progesterone, they will be very high in pregnancy. Immediately after birth, within 24 hours, they will drop quickly. If you pay attention as a woman, you will notice that when you are in your period, you're not in your best mood. When you're ovulating, you're not in your best mood. Why do you have all these mood swings? Because your estrogen and progesterone are fluctuating. The problem is, during childbirth, it drops abruptly. And whenever it drops, it has consequences. So the sudden change in the hormonal level can lead to depression. This is similar to what will happen to you when you're in your period, but it's extreme during childbirth. Now, also, some women might have thyroid problems. So thyroid hormones are the hormones that contribute and control pretty much everything we do in our body. When you have the lower level of the thyroid hormones during pregnancy, or if it drops after childbirth, it can also elicit symptoms of depression. So what do? We collect a blood sample and we diagnose and give you medications if need be. Other feelings may contribute to postpartum depression. So what are the common presentations in a new mother? Definitely a new mother will feel tired after labor and delivery. Definitely she'll be tired from lack of sleep or broken sleep. Definitely she's going to be overwhelmed with the new baby. Definitely she's going to be having doubts and ability that she's a good mother. She's going to be stressed. It's expected. Okay, she's gonna feel unrealistic about being a perfect mom. Everybody wants to be a perfect mom, but there is no perfect mom out there. We all know that we have good mothers. So some of them will actually start having, grief about the loss of who they used to be. Some women will begin to look at their breasts that used to be pointed. Now their breast is sad. Some women will begin to look at their belly. Oh, my belly is too big. So a couple of things, identity crises will start creeping in, and you feel that you're less attractive. But guess what? Motherhood is a labor of love. You give something to get something permanent. You are giving up something temporal to get something permanent. Some women will begin to complain about stretch marks. It doesn't matter. Some women will begin to complain about CS. It doesn't matter. You have a permanent joy that nobody can take away from you. And some women will begin to feel, oh, I don't have time. I used to have time to talk to my friends and do all that. You have to understand that something bigger than you has taken over your life. Postpartum depression is a serious health condition, and thankfully, we can treat it perfectly. Postpartum depression, it's not regular, it's not expected. So can certain conditions make you to be more prone? Yes. You may be more prone to postpartum depression if you have a personal history like Stephanie mentioned, if you have a family history, if you don't have support of your family and friends, if you were depressed during pregnancy, if you had problems with your previous pregnancy or birth, if you have a bad relationship, if your partner is not supporting you, if you don't have money, money is important. Anybody that is telling you money is not important is deceiving you. If you don't have enough financial muscle to take care of a baby, to take care of the bills, if you don't have enough support system financially, you're going to struggle. If you are younger than 20, if you were previously into alcohol and illegal drugs, definitely you're going to struggle. So more teenage mothers are going to be predisposed to having postpartum depression. If you have a baby with special needs, so if you have a baby that has Down syndrome, congenital problems, definitely you're going to feel overwhelmed. If you have difficulty breastfeeding your baby, if your pregnancy was not planned and wanted, definitely these are signs, these are conditions that can make you predisposed to having more possibility of developing postpartum depression. Now, in America, where I reside, the Preventive Service Task Force actually recommends that all doctors must look for and ask about symptoms of depression during and after pregnancy. Very important. So if you go to see your doctor during your ANC, please be very open to discuss every single details you don't understand. Now, I'm going to give you a couple of tips. So here are some ways you can begin to feel better, or you can get more rest in addition to talking to your healthcare professionals. So these tips are not final. These are the things you can do at home while you're setting yourself up to go and see a doctor. Please rest as much as you can. Sleep when your baby is sleeping. That means you might be sleeping a lot in the day. If you notice, some babies sleep more in the day and they stay more up in the night. Whenever your baby is sleeping is an opportunity for you to sleep. This is where we need the man. When the baby is sleeping and the mother is sleeping, stand by. When your woman has not slept, take over. You can pump your breast milk. You can be a replacement mother while your wife is getting sleep. This is how to be a good father. I remember when I had my daughter came early at 26 weeks. I completely had no life. Everything was all about her and my wife. Don't just prioritize the baby. Some parents, some fathers, some mothers forget the mother and they focus all the attention on the new baby, and it can stoke a lot of bad emotions. So let's also look after the mother. Without the mother, there won't be baby. So please don't try to do much. Just do the little you can do and delegate your domestic chores. Please, very important, ask your partner, family, friends for help. Take some time out. Find out if you're a worker, find out how your organization can help you. Make time to go out, visit your friends, spend time alone with your partner, communicate. Talk to people about your feelings. Talk to your partner about your feelings. Look for supportive family members. There are some family members that might be actually pouring fuel to the inferno. It might be your mother, it might be your mother-in-law, it might be your sister, it might be your father. Please identify supportive family members and friends. Talk with other mothers. So look for support group. Most mothers that have become mothers, they have good experience, but listen to the good experience. Some of them might give you the negative experience. Don't always stick out for the negative experience. There is always something good about an experience you're having. People are so afraid to become pregnant. People are so afraid to go into labor. People are so afraid of CS because of what people told them. No two people can have the same experience. So talk to people that will give you positive support. Join positive support group. Ask your doctor and nurse about groups in your area. Don't make any major life changes during childbirth. This is very important. Having a baby is already a big life-changing experience. For example, don't plan to move when you just had your baby. It's gonna wreck your life. Don't plan to switch jobs. Just take care of your baby for now. Sometimes those big changes can be avoided. If this happens, try to arrange for support and help in your new situation ahead of time. It can also help to have a partner, a friend, another caregiver who can help take care of your baby if you're truly depressed. So assuming we have diagnosed you have PPD, please find someone trusted. It might be your mother, it might be your partner, it might be your friend who can look after your baby while you're battling depression. Very important. If you are feeling depressed during pregnancy or after having your baby, don't suffer alone. Tell a loved one, call your doctor right away. If we can do all this, trust me, we are gonna crush postpartum depression and we are gonna save our family. Remember, it takes a village. We are because you are, and you are not alone. Thank you so much. That's my presentation. Okay. All right. Okay. So at this juncture, if you have any question, please feel free to ask your questions. I'm gonna take care of your questions, and we're gonna transition to the other stage of the event. The event is actually coming to an end. So if you have any questions, you can raise your hand, you can contribute, or you can shoot us a question on the chat. Please feel free to do that. Remember to mute your audio, please. Please, very, very important. Please start asking your questions. All questions are valid. And I believe Stephanie is still on the floor, right? So Stephanie, I'm gonna pin you to the floor so we can take care of the remaining questions. Is Stephanie still
No, I
here?
don't come out now. I did downstairs.
Okay, please feel free to ask your question. Uncle Chimex, remember to mute yourself.
Oh, voila. Okay, thank you so much. Thank you.
Uncle Timex, mute your phone. Mute your mic. Unfortunately, he's the host. Yeah. Okay.
Sheila Dugu, please take the floor and ask your question. Go ahead. Sheila?
We'll have to unmute her.
Okay, thank you. Thank you very much for your presentation. But in Africa, you know that we have all the needs like we want, like we are with our families. So when you give birth, they can come around to take care of you. But like elsewhere, like when you travel outside your country, far away from your family, it's very costly. And I know somebody who went through that stage of depression. Like it looks like everybody was busy and it was very costly also bringing her family to take care of her. So in that situation, she managed, but it's had a whole lot. She went through a whole lot. So in that situation, what will, like, when you find yourself in such situation, how would you manage to come out of it? Because it's a process. It's a process for you to go through all these things, like a step-by-step approach. Yeah.
Correct. Thank you so much. That's a very valid and important question. So this is what I know. mothers are very strong people. And there are always community support where you live, especially if you live outside Nigeria. Now, what you need to understand is to understand that motherhood is not a dash. Motherhood is a marathon. So when you deal with your reality, when you deal with your expectations, because the problem is we expect a lot. We want so many things to happen at the same time. If this your friend is living in a community where it's difficult to bring the parents to kind of stimulate what we would have had in Africa, but she can't have it in her community, that's the point. Before she leaves the hospital, she can have open communication with the facilities and they can introduce her to the community. There are so many support groups out there. You see, sometimes the people that might help you might actually be strangers. It might be people in your church. It might be your neighbor. It might be people you don't even think are your friends. It might be your colleagues. So we have to always identify the strong family support. Like I mentioned, there are some families that the mother, the father, the siblings might actually be the negative factor. And there are some people that might actually get the help from the people they don't even have commonality with. So it's all about understanding your role. And this is also where your partner can come in. It's not just the woman that should become pregnant, have the baby, look after the baby. So the question is, what role is your partner playing? You know, sometimes we need to juggle up and change some settings in the family. So the man might be the breadwinner, be providing, or the woman might be, we've seen situations where the woman is the breadwinner. And it's still expected that the woman should still go to work, pump her breast milk, come back, cook, do the domestic chores. So we have to start from within. So who is the support system of this woman? What about the partner? Is the partner helpful? What can they do together to adjust? One thing I know, looking after a baby is tough, but over time, they grow so fast. You blink and they are independent. It's a journey that gets better over time. It's a gift that keeps giving. So don't focus on the negatives. Oh, this person is not helping me. Oh, my mom is not able to come. Oh, my father is not able to come. What can you use in your immediate micro environment? There is always a community resource you can glean from. You can call the hospital where you delivered and they can connect you. It works. Okay? Thank you so much for that question. Please, do we still have any other question? Do we have any other further question? We're actually coming to the end of the event because we've got other things coming up. Please, if you have any question, feel free to ask. Edie, do you want to contribute? Go ahead.
Yes, sir. So thank you so much for the presentation. Really appreciate. Okay, so I would like to know if it's PDD is something that it concerns DNA, because I saw a movie that the mother was telling the daughter that when I was pregnant for you, this is what I experienced. So I don't know if it's real or it's just fiction. So I'd like to know if it's something that is continuous in the family.
Okay, the answer is yes. So if you notice, when you're sick or when you have gynecological problems, we ask a lot of family and social history. So remember the evolution of a baby. I think I have my teaching slide, so I'm gonna use it. So this is the body of a woman. This is the internal reproductive system of a woman. Yes, so sir. When the egg is released from here and the sperm comes in through here, the father's sperm contains XY chromosomes. The mother's egg contains XX chromosomes. So a woman can only be XX. The man can be XY. So it's actually the Y chromosome that determines if you're gonna be a boy. Now, why am I bringing this in? When the father is introducing the sperm, there are so many genetic components in the chromosomes, good, bad, ugly. So the father can transmit a couple of good genes. You can look like your father. You can have diabetes. You can have hypertension. You can have other medical problems. The mother can do the same. So in some situations, some families can have what we call familial tendencies for medical problems. So a family that has diabetes, hypertension in the family can also have depression in the family, can also have bipolar disorder in the family, can also have early menopause in the family. So anything that it's in your family can easily be transmitted to you. Cancer. So this is why we ask a lot of questions. So yes, if your mom had postpartum depression. If your sister had postpartum depression, the possibility you're going to develop it is very high. So the answer is yes. It can be inherent. It can be familial.
Thank you, sir.
You're welcome. Please, do we have any other question? If we don't, then we're going to adjourn. And thank you so much for gracing this event. And please, when you go back, be the voice in your community. If you still have questions, feel free to ask. This is your opportunity to ask questions directly. Do we still have Stephanie in the floor?
No,
Okay.
she's not.
Okay, so at this juncture, I'm going to invite the founder, Engineer Ife, to give our closing statement. Ife, please go ahead and give your statement.
Oh my God, it's been an amazing session. Can we all give a round of applause to Dr. Chudi, the speakers, and Connie, the performer, you all, and all of you also for attending today. You've all been amazing, 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 amazing session. Could you drop an emoji on the chat box to say how you're feeling, what you've gained, one word that you got from today? Honestly, excellent presentation, says Chinwe. It's been amazing. Thank you so much, everyone, for joining today's edition of the Face Youth Monthly Mental Health Awareness and Stigma Reduction Seminar. We're really grateful to you, and your feedback is valuable to us for continuous improvement. This is the last presentation of the year, so we are really grateful to all of you. Please share the recording when you get it, because the idea is to be able to impact our community and help everybody live a fulfilling life, So we're really grateful to you all. Thank you. Thank you so much. Uncle Timex, you've been amazing. Dr. Chudi, oh my God, doubling up as an anchor and a guest speaker. The reason why we do what we do. Dr. Chudi is one of our directors, our Face Youth Board of Directors. So we're grateful to him for giving selflessly. This year, he's anchored about 80% of our events, and we can't thank you enough. We understand that so many people are away today because there are so many events leading up to Christmas, but we're very grateful to you. Like Dr. Chudi said, it's important that we have ambassadors, and please go into the community as an ambassador and spread the word, help somebody. You may not be able to change the world, but you can change one person at a time. You can imagine if each and every one of us, if we're able to impact at least one person, the world is going to be a better place for people in our community, at least. We're very grateful to you all. So quick announcement, there won't be any seminar because our initial program says 17th of December, there'll be monthly mental health awareness seminar. No, so it's going to be our Christmas party. We are supposed to have a ball and fundraising festival on the 17th of December in Aberdeen. We'll try to live stream it so that we'll give people the opportunity to join the fundraising draw, the raffle draw. We have amazing prizes from Amazon vouchers to train tickets to, fingers crossed, we're hoping for even a flight ticket, by Virgin. They have promised us, but we haven't really seen it. So please attend that event if you can. We'll try to stream it and send the Zoom link. We are grateful. We are going to recognize all our guest speakers and recognize all the people that have contributed positively to Face Youth from inception till today. We are grateful to each and every one of you. Thank you for joining us today. We really appreciate you. And do have a very lovely evening and a good weekend. And see you on the 17th if you can join. If you can't join, keep us in your prayers and remember to be an ambassador and spread the word. Thank you so much, Uncle Chimex, for covering for the IT team today on behalf of the entire team Face Youth. Thank you, Stephanie. You are amazing. I know that you've logged out, but you are going to see the video. Connie, I have no word for you. You are so talented. You are amazing. The world is yet to see what you're made of. So keep being amazing, keep being yourself. Thank you so much. Thank you. So on this note, we'll be signing out. If you have any question, you can still send us an email, info@faceyouth.org. We really appreciate each and every one of you. Thank you. Thank you so much. We're also grateful to AGVO, the Scottish government, through AGVO in Aberdeen, for giving us the opportunity to run this program continuously this year. We're grateful to Belma Engineering for donating the Face Youth Center to be used for our monthly mental health events. We're grateful to Aberdeen City Council and Robertson Trust, the Robertson Group, as well as many of our sponsors that we can mention today. We are very grateful to you all and we love you. Have a very good evening. And if you are not joining us on the 17th, Saturday, the 17th of December, we wish you all a very Merry Christmas. Yeah. Thank you. Bye.